Today's topic for discussion is full veneer crowns. Despite the advances in prosthetic dentistry, full veneer crowns have been the best treatment option in most of the cases. These are well considered because of the improved retention. Controlled laboratory studies have shown that these type of restorations are superior to partial veneer restorations in case of both in good retention and also the resistance forms. But these shouldn't be the treatment option in most of the cases. It is to be considered only when the restoration demands high retention. So what are full veneer restorations? These are the restorations that cover all the coronal tooth structure, in the sense all the surfaces. Where are these indicated? So before we go with the indications, you have to see the types of full veneer crowns. This depends based on the type of material you are giving. It can be either cast metal or porcelain-fused-to-metal or an all ceramic type of full veneer restoration. So what are the indications of complete cast crowns? Complete cast crowns are indicated in cases where the tooth has excessive destruction of the tooth structure. In cases where the tooth had been extensively damaged due to caries, where all the surfaces are involved, or prior restorations that have been done on all the surfaces. And also short clinical crowns. In such cases, if you go with a partial veneer crown, the amount of retention will be very less and the restoration will be compromised. In such cases where there is short clinical crown, it is mandatory that you go with a complete coverage restoration. And in cases where the crown is to be used as a retainer for a long span fixed partial denture. In long span fixed partial denture, due to increased flexibility, you have to look for a good retentive retainer. In such cases, full coverage restoration is mandatory. And in endodontically treated teeth, where the tooth will be already destructed due to caries, and also added to that the amount of access opening reduction that you have done will reduce the amount of dentin so that the tooth will get weak. In such cases, you have to get the tooth under good control by using a complete coverage restoration. And also in case of generalized attrition cases and in support for a removable partial denture. In cases where you have to give a cast partial or a removable partial denture, if the tooth is not proper, if you have to modify it more to have good retentive features, if you think partial veneer is not a good option, in such cases it is must that you have to go with a full veneer restoration. Coming to the contraindication. Contraindications are if the treatment objectives can be met with a more conservative design. In such cases, you have to always vote for the more conservative design like a partial veneer crown. And in cases where extensively restored or cariously involved teeth, you can give a complete cast crown if it is in an aesthetic zone, because complete cast crown doesn't add for good aesthetics. In such cases, it is better you go with a porcelain fused to metal or an all ceramic cases, depending on the amount of tooth structure and the amount you can reduce. Coming to the advantages. As it has total coverage, it will increase the bonding surface, hence improved resistance and retention form. Also, it has superior strength because it is surrounding the tooth on all the surfaces. Also, the amount of reduction that you do will lead to the duplication of amount of metal you get in it. So, more the metal, more the strength. And occlusion modification can be done very easily, as you will be reducing the whole tooth structure. You can even change the occlusal scheme you have, and also coronal integrity can be maintained. The disadvantages are the amount of tooth reduction will be more when compared to other conservative designs, and also it is no longer feasible to perform any electrical pulp testing just in case if you have to test the vitality of the abutment. And it is non-aesthetic when compared to other porcelain coverage restorations or all ceramic restorations. Hence, it can't be used and it is contraindicated in cases of aesthetic zones. Coming to the tooth preparation. Look at the armamentarium that is required for tooth preparation. You need a handpiece, rounded tapered diamond, torpedo diamond, number 171 L burr, torpedo burr, short needle and a red utility wax to check the amount of reduction. First, you have to start the reduction with the occlusal surface. Once you are done with the occlusal reduction, you can actually assess the tooth based on remaining occlusal gingival thickness Depending on that, you can actually plan about any additional retentive features that might be required in such cases. So starting with the occlusal reduction, you have to start depth orientation grooves with the help of a tapered round end burr. Using this burr, you have to place a depth orientation groove of 1 mm on non-functional side and 1.5 mm on the functional cusp side. So depending on the tooth, if it is mandibular, your functional cusp will be the buccal cusps of the lower teeth, and if it is maxillary, it will be the palatal cusps. In such cases, according to the tooth you are preparing, you have to reduce at least 1.5 mm on the functional cusp and up to 1 mm on the non-functional cusp. So accordingly, place depth orientation grooves on the occlusal grooves and triangular ridges. So once you place the occlusal grooves, it will actually give you a guidance for the amount of reduction that you have to do. So you have to place 1 mm depth groove on the non-functional side and 1.5 mm on the functional side. And this occlusal reduction is to be done into two halves. First, reduce one half of the tooth so that other half can be taken as a reference. So once you do the required amount of reduction, the second step will be your functional cusp bevel, which is a part of occlusal reduction. In functional cusp bevel, you have to use the same tapered round end burr, and the burr is to be placed at 45 degrees to the axial surface. At this angulation, you have to reduce up to 1.5 mm. You have to round the axio-occlusal line angle so that there will be even 1.5 mm reduction on the functional cusp. And this should be, the slope should be maintained and it should be parallel to the opposing incline of the opposing cusp. So that is how you will actually help in minimum amount of material that can be duplicated with the restorative material. Then after that, you have to go with the facial and lingual surfaces, the axial surfaces. So take the same round and tapered diamond, and using that you have to place depth orientation grooves on the facial and lingual surfaces. Once you place the depth orientation grooves, you have to go ahead with the reduction, and just see that gingivally you are supragingivally, never enter into the gingival area if it is a cast restoration, and as it is in a posterior region, your location of the margin doesn't really affect aesthetics. Hence, you have to always go with the supragingival margin in case of posterior teeth to help in maintenance of hygiene. So, as you are going ahead with the facial and lingual reduction, you have to see that only half of the burr head is to be into the tooth structure. If you totally take the burr into the tooth structure on the facial and lingual sides, there will be development of slight unsupported enamel lip on the margin, and you will have to use other additional instruments to reduce that, and this is actually more than what is required. So hence, as an index, you have to just see that only half of the burr head is into the tooth structure. So once you reduce the facial surface, you have to come to the lingual surface. So as you are extending into proximal areas, you will be left out with a thin lip of tooth, which will be reduced with the help of a short needle in case of posterior teeth. So in such cases, after you are done with the facial and lingual reduction, you have to go with a short needle burr, and you have to break the contact by moving it in a sawing motion, occlusal gingivally and also facial lingually. That is how you break the contact. Once the contact is broken, you have to extend from lingual to facial with the help of a torpedo or a round and tapered fissure burr, so that your finish line will be maintained. So final finishing of the margin should be done using a torpedo diamond, where you will have a rounded margin on the internal surface, which will actually help you in good amount of metal and also proper burnishing of the metal in the casting. After you are done with the axial reduction, you have to go ahead with the retentive groove placement. So depending on the requirement of additional retentive features, you have to place a retentive groove with the help of a straight fissure burr, either on the buccal or palatal surface. You have to go up to the full depth of the burr, and it should be up to 0.5 mm away from the finish line. Once you are done with the placement of retention groove, it is your finishing step. So go with the finishing burr number 171L burr on the occlusal and axial surfaces, and with the end cutting burr on the finish line. Once the finishing is done, you are done with the preparation, and you have to go ahead with the impression stages. So you can see all the features incorporated in the preparation and the functioning, the function they are giving with the help of that feature. The next type of full veneer restoration is porcelain-fused-to-metal. So where is it indicated? In cases where there is aesthetics required. In case of aesthetic zone where aesthetics is a consideration, you have to go with either porcelain-fused-to-metal or an all-ceramic restoration based on the amount of tooth structure you are having and the amount of aesthetic demand the patient has. So, and if an all-ceramic crown is contraindicated, it is must that you have to go with the porcelain-fused-to-metal. In such cases where you can reduce very less tooth structure, you can't go up to 2 mm of reduction to give a all-ceramic crown, it is better that you go with the porcelain-fused-to-metal crowns. Contraindication. These crowns are, full veneer crowns are contraindicated in a patient with high caries index who is at a risk for more caries. In such cases, it is better that you avoid full veneer restorations. And in young patients where the pulp horns are very high, in preparation for a porcelain-fused-to-metal, you have to go with a more amount of reduction. In such cases, these type of crowns are contraindicated. And where a more conservative retainer can be possible, in such cases you have to avoid this type of restorations. And if you have any intact buccal wall, in such cases it is better you preserve that buccal wall to help in aesthetics and also to maintain natural buccal surface. Go with a partial veneer crown. Advantages. This has only one advantage over the cast restoration, which is aesthetics, as it is lined by a porcelain, surface is covered by porcelain restoration. You can help and match the aesthetics with the adjacent teeth. In such cases, the patient will be very happy once the aesthetics is maintained. In such cases, you have to go ahead with this, and this is the one advantage. And what are the disadvantages? This requires significant amount of tooth reduction. When compared to cast restoration, this requires more amount of tooth reduction as the metal has to take a porcelain over it. And for aesthetics, margin is to be always placed subgingivally if you are in aesthetic zone. So subgingival margins have their own problems of hygiene maintenance, and it can't be given in patients with high caries index. And it is easily subjected to fracture once if the reduction is not properly done or if the occlusion is not properly set. In such cases, as ceramic is very brittle, it will tend to fracture. Hence, case selection is very important, and not just the case selection, also the technique and the cementation is very important. So it is difficult to obtain accurate occlusion in case of a glazed porcelain. Unless you have good laboratory support, it is very difficult to duplicate the occlusion. And in shade selection, it will be very difficult. So coming to the crown preparation. After you are ready with the armamentarium required, you have to start with the crown preparation. The steps are same when compared to the cast restoration, but only thing is here, during the proximal reduction, you will actually maintain a lip of denting. Your buccal reduction will be more when compared to the lingual reduction. Buccal reduction will be more because of increased amount of reduction due to the incorporation of porcelain in your final restoration. So for you to incorporate or for you to overlay your metal with the help of porcelain, in such cases the reduction will be more for aesthetics on the buccal side, because you have to develop the gradient and translucency on your buccal side. For aesthetics you have to reduce more, but in lingual it is okay if the reduction is slightly less. So as you are gradually tapering the restoration, buccally it will be more and lingually it will be less. So there is a chance of developing an unsupported dentin. So or you can actually leave it to slight more amount of thickness and place it slightly lingual to the contact. In such cases, this will actually help you in anti-rotation and also improve in the torque. Okay. This can be actually used as a secondary retentive feature. So this is the only difference if you consider the preparation with compare it with the cast restoration. This is the only difference, and also the finish line. Here the preparation belt will be a flattened tapered diamond, but whereas in that it is a rounded tapered diamond. So once the preparation is done, you have to go ahead with the finishing using a number 170 L burr and a end cutting burr. So looking at all ceramic restoration, which is a third type of full veneer restoration, the indications are in areas where you have high aesthetic demand. In case of anteriors, upper or lower anteriors, where the patient is too young and demands high aesthetics, in such cases all ceramics are the best treatment option you can go ahead with. And contraindications are when more conservative restoration can be given. In such cases, it is better you conserve the tooth structure, because if you go ahead with a full veneer restoration like all ceramic crowns, the amount of tooth reduction will be more. It will be up to 1.5 to 2 mm. In such cases, it is better you go ahead with other conservative options like a porcelain-fused-to-metal. If it is an aesthetic zone, or if it is a non-aesthetic zone, you can directly go ahead with a cast restoration. So it is not indicated in molar teeth where the forces are more. As ceramic is better capable of taking compressive loads than shearing, it is better you avoid it in case of molars. Then coming to the advantages, it has superior aesthetics. Due to the more translucency it imparts, as there is no opaque metal inside, it is totally all ceramic. It has good light properties and more translucency, which will add for more aesthetics. Disadvantages, it has reduced strength as it is a brittle material, and due to the more amount of tooth reduction required, even your tooth can be weak in cases where you had earlier a bigger cavity or a very big axis opening in a tooth. So it is not effective as retainers for FPDs, as it is a brittle material. You can't use it as a retainer for a long span FPDs. And where on opposing teeth is possible always, because if you have done any occlusal corrections on an all ceramic restoration and if it is left unglazed, so it can actually abrade the opposing natural tooth structure. So this is to be considered when you are giving an all ceramic crown. And also, if inadequate tooth preparation is done, where the restoration, which is your all ceramic crown, can be thin, in such cases it will tend to fracture. So coming to the preparation of all ceramic crown. Here the difference between other crowns and all ceramic crowns in occlusal reduction is the amount of tooth structure. So the amount of tooth structure reduction will be 1.5 to 2 mm in these cases. So on functional cusp, it should be must that it should be at least 2 mm of reduction, and on the non-functional side it is 1.5 mm. And this amount of reduction will help you maintain the gradients in the translucency, giving it more lifelike appearance. And functional cusp bevel is to be placed same as other type of full veneer restorations. The facial and lingual surfaces will be reduced, and after that the proximal will be reduced. Here the finish line will be a shoulder. So shoulder will lead to more amount of tooth reduction at the finish line, and this will add for the bulk of ceramic there, which will give good strength for the restoration. All the reductions can be checked. The occlusal reduction can be checked with the help of a utility wax, 2 mm utility wax, and the axial surfaces can be checked if you have a silicone index which is made prior to the reduction. So in order to have good dexterity, you have to first take a silicone index before you start with the reduction. You have to cover both facial, occlusal and lingual surfaces, and once this is polymerized, you have to cut into half and then use one segment to assess the amount of reduction you have done. So once proper reduction is done according to the amount of reduction required, which is up to 1.5 to 2 mm, you have to place a retentive group and then finish it. So now that you have learned about the types of full veneer restorations and the differences in the preparation steps, you have to go ahead with a good preparation. So what are the possible common errors in cases of tooth preparation? So in cases of tooth preparation, it can be a chance where you do more than required occlusal reduction. So this will reduce the retention, and if the occlusal reduction is insufficient, in such cases that might lead to weak restoration. Lack of uniform reduction. So you have to have a smooth amount of reduction and smooth continuous finish line. If there is lack of uniform reduction in case of all ceramics, you won't be able to duplicate proper aesthetics, or you won't be able to duplicate proper translucency of the natural teeth. In such cases, this will be a problem. And also if the finish line is not proper, so if it is not smooth, in such cases you might lead to a rocking restoration, and if you are going too subgingivally, you might affect the biologic width. If there is excessive taper of the proximal surfaces, that will compromise your retention. Your taper should be limited to 6 degrees in total. The angle of convergence should be only 6 degrees and taper on one axial surface should be only up to 3 degrees. And also a variable shoulder width. As I had already mentioned about the finish line preparation, your finish line should be even all round except in porcelain fused to metal, where the amount of reduction varies on the facial and lingual surfaces. And undercuts on the distal lingual surface of the preparation, and also rough tooth preparations. If there are any undercuts, so once you are going ahead with the next laboratory procedures, you will have to relieve the undercuts. This will lead to more amount of space that which will be occupied by your luting cement. So once the luting cement will be more, the strength there will be less. So in such cases, you might end up losing or having a compromised retention. So try and avoid any undercuts if possible, and rough preparations might lead to any lockage of impression materials and your final steps won't be proper. In such cases, you should make sure that your preparation is to be finished after you are done with the whole reduction. So coming to the summary, you have learned and you have seen the types of full veneer restorations and the amount of reduction required, and also the indications and contraindications. So keeping all this in mind, you have to go ahead with the proper treatment planning and then go with the proper reduction of tooth structure. Once this is done, other steps will go unparalleled.